Spleen forms connective tissue. The connective tissue attaches our skin onto the muscles and holds and supports our internal organs in place. When the connective tissue loses its tone, skin tends to hang loose from the muscle and stretch marks form. Internal organs may prolapse. Uterus, kidneys, stomach, and hernias and varicose veins may occur. The connective tissues are nourished by spleen, blood, and yin, and firm by spleen qi, the function. To improve the tone, points and diet for tonifying spleen qi should be used. Local treatment, we do tapping with a plum blossom hammer. Spleen and stomach open to mouth and lips. The mouth is the doorway to the digestive system. It reveals the energy situation in the spleen and stomach. Inflammatory conditions such as stomatitis and gingivitis, ulcers and sores in the mouth, red inflamed lips, these are signs of excessive yang in spleen, stomach. Dryness, cracked or peeling lips indicate yin deficiency in the stomach. According to TCM, spleen dislikes dampness, and in a qi deficiency situation, dampness tends to stagnate. The stomach likes some dampness, hence the liking for creamy, milky, and fatty foods. It needs some damp foods in order to perform its digestive functions well. The spleen, as an organ that absorbs and stores nutrients for the whole body, can have a nutritional deficiency, which is then called blood deficiency. Clinically, this could manifest in underweight and malnutrition and receding pale gums, could be bleeding gums, although this could be a symptom for kidney yin deficiency as well. The center of the tongue, which represents the energy condition in the spleen and stomach, could be deeper than the rest of the tongue. So let's mention another sign of spleen imbalance, teeth marks on the sides of the tongue. It is a symptom of edema on the tongue. Hence, the teeth make impressions on it. To have teeth marks, the patient should have edema on the tongue, and he must have teeth. Often, old patients do not show teeth marks, and it is not always because they do not have edema on the tongue. Spleen edema, when mild, manifests in 3 locations: tongue, upper and lower lids, and the hands and feet. When severe, spleen edema manifests on the whole face, lower arms and legs, and the tongue. The difference is in the size of the tongue. When spleen qi is deficient, there is only a problem in the circulation of thick fluid. Tongue is normal size and has teeth marks. When there is a stagnation of fluid and storing of excess nutrients, patient is obese and has a larger tongue with teeth marks. And when a malnourished patient has spleen blood deficiency and edema, for example, kwashiorkor, the tongue is small but has teeth marks. Therefore, teeth marks on the tongue do not always indicate excess fluid retention. They also indicate poor circulation of fluid. It is the tongue size, how thick and broad, that is indicative of the quantity of fluid and dampness. So here we have the tower diagrams, like a thick and large tongue with teeth marks, edema in the face, lower arms and legs, overweight. So here you could see a very increased yin, which led to a decrease in the yang. So next is normal sized tongue, edema in the lids, hands and feet. And the last one, small tongue, pale, thin, undernourished patient, edema as above. Color of the lips are significant for diagnosing energy status of the spleen. Red inflamed lips, spleen or stomach yang excess. Dry, cracked or peeling lips, stomach yin deficiency. Purple lips, spleen blood stagnation. Pale lips, spleen blood and qi deficiency.